Hi everyone, I'm Mindy Hauk, and I'm going to video record my Adderall speech. Here's my fiance Jason, and he's going to video record me. Right like that. So, first of all, what is Adderall? That's going to be the most common question anybody's going to want to know. Adderall is a drug used for the treatment and control of attention deficit hyperactivity disorder, also known as ADHD. Adderall is also used to treat narcolepsy. These are neurological disorders that can affect both adults and kids alike. The drug itself controls impulses, distractions, and causes sluggishness. Basically, Adderall is a drug that helps you focus. Researchers have shown that Adderall affects certain parts of the brain, which are responsible for the task of executing the mind's decisions. If this part of the brain, known as the frontal cortex, fails to operate properly, then the person experiences a lack of focus and an inability to finish the task at hand. Adderall produces a stimulant known as dopamine. Dopamine is responsible for the reward-feeling behavior. Adderall makes the user experience increased awareness and focus due to all the dopamine flowing in the frontal cortex. Adderall is becoming a dependent drug. Students love the feeling of focusing and seeing the reward it entails. So why is it becoming a problem? Students in colleges have reported cases of inability to concentrate in their studies and hope to get their hands on the concentration-enhancing drug Adderall. As a result, they have been properly diagnosed with ADHD and have started to use the drug for recreational purposes, also to enhance concentration. That's the main reason. Students will take Adderall just to get through their exams. They hope a miracle will happen and they will get that awesome grade they're earning for, but in reality, it just makes them stay awake and stay focused. While on Adderall, students will remain focused majority of the time, although any attempts to distract the student may cause agitation to the user. The drug obscures the user's mind from creativity and attempts to alert him or her if they focus on anything else besides the task at hand. The problem becomes how the student is able to obtain Adderall. Basically, students are going to their doctors and faking their symptoms so that they get diagnosed with ADHD. Then in turn, they are prescribed Adderall. At this time, all the students is thinking about is, yes, I will be able to make it through my exams, when in reality, they're not thinking about they could become addicted to the drug. Let's take a look at some of the side effects and symptoms of taking Adderall. Elevated heart rate, feeling woozy, fainting, serious headaches, seizures, delusions, lightheadedness, fuzzy vision, chest pain, numbness, involuntary muscle spasms or motor tics, and increased blood pressure, sleepiness, reduced desire to eat, dehydration, and weight loss. These are just some of the symptoms students admit to having with all of these risks, with all of the risk involved in taking Adderall. For a student to take Adderall, there's just for passing an exam. Also, Adderall is known to inhibit creativity. Now, out there, who wants to have their creativity inhibited? I know I don't. I feel that a student should study and be prepared for an exam. This way, when they get that grade, they feel the reward. Taking Adderall just makes them focus and concentrate, and they're not feeling that reward they get if they would just study and pass the exam like they should. Adderall is a drug that can seriously harm you, so just study and make the grade. Students using Adderall as a smart pill, and it's basically cheating. Now I want to take a look at the use of Adderall in sports. I myself am a huge Orioles fan. If you can see behind you and what I'm wearing, that's just who I am. Orioles first baseman and slugger Chris Davis got suspended for 25 games as a result of taking Adderall. Chris Davis is documented as having ADHD. In the 2013 season, Chris got an exemption to take the drug Adderall while playing. This is the season he had 53 home runs. People started to put two and two together and realize maybe he's doing so well because of taking Adderall. Last season, in the 2014 season, Chris Davis was denied the exception to use Adderall while playing. In the 2014 season, as you might have suspected, Chris didn't do so hot. He only hit 26 home runs, didn't even come close to his 53 home runs hit in the 2013 season. Basically, he was in a slump. So what does Chris do? He takes Adderall to try and compensate and see if it'll help him make him focus and improve his game. In the Major League Baseball Association, players are randomly drug tested. Earlier in the 2014 season, Chris was tested, and Adderall came up in the test. He was given a warning and told to stop taking it. Of course, he didn't listen and continued to take it. He was tested a second time later on in the season and failed, and he was slapped with a 25-game suspension. This, of course, happened during the worst possible time of his career. The Orioles were starting to go to the postseason, and he couldn't do anything about it. What all of this information I'm giving you is to prove Adderall is addictive. Chris Davis knew the consequences if he continued to take Adderall, and what did he do? He harmed himself and his teammates' careers by continuing to take Adderall and landed a 25-game suspension for it. In reality, people, it's not worth it. With this information I presented you with, the question then becomes, should the use of Adderall be used in sports? In my opinion, it should not be used in sports, period. People cheat the system every day in order to get this drug and use it. Most people who are prescribed Adderall do not even have ADHD. They use the drug to focus and improve their performance ability. What is horrible in all of this is the people who really need it, the people who really have ADHD and should be prescribed it, are going to be labeled liars and cheats. It's a sad, sad world we live in. That's all. I hope you have a great day. Thank you.